Parents, in my clinic, every single week, I see the same situation. A parent comes in and says, my child's teacher told me he might have ADHD. But then another doctor said, maybe it is autism. And now I don't know what to believe. This confusion is completely understandable because ADHD and autism do share some overlapping features, but they are fundamentally different conditions. And the treatment approach for each is very different. Today, I want to give you clarity, not just on how to tell them apart, but on what to actually do if you suspect either one. Now, let me first explain why it's a matter of confusion. Both ADHD and autism can cause what we call attention difficulties. A child with autism may appear inattentive because they are hyper focused on their own internal world. A child with ADHD may appear inattentive because they cannot sustain focus on external demands. From the outside, both can look like a child who is not listening. Both conditions can also involve emotional dysregulation, meltdowns, frustration, difficulty with transitions. And both can involve what we call social difficulties. Though, and this is very important, the reason for social difficulties is completely different in the two conditions. This is what I want parents to understand deeply today. In autism, the primary area of impact is social communication. This means the child's ability to connect with other people, share attention, use language for social purposes, and understand social cues. All of this is affected at a neurological level. It is not that the autistic child does not want to connect. It is that the way their brain processes social information is different. Eye contact may be uncomfortable. Joint attention, where a child points at something to share it with you, may be absent or delayed. Language may develop differently or be delayed. Now, in ADHD, the child typically wants to connect. They want friendships. They want to be included. But their impulsivity and inattention gets in the way. They may interrupt conversations. They may lose track of what someone is saying. They may say something inappropriate, not because they don't understand social rules, but because they acted before thinking. This is a very important distinction. Both ADHD and autism involve attention difficulties, but for completely different reasons. In ADHD, the primary issue is executive function, the brain's ability to plan, organize, start tasks, and stay on task. Stay on task and regulate impulses. All of this is affected. A child with ADHD can be extremely focused on something they find stimulating, like a video game or a drawing. But the moment the task requires sustained, effortful attention, they struggle. This is what we call variable attention. In autism, attention difficulties, when present, are often connected to sensory processing or rigidity of thinking. A child may become intensely focused on a specific topic, what we call a special interest, and find it very difficult to shift attention away. This is not the same as ADHD attention, and treating them the same way would be a mistake. Now, here is something that surprises many parents. Research has shown us that approximately 50 to 70% of autistic children also meet ADHD criteria. This combination is sometimes called AUDHD. And this is exactly why clinical assessment is so important. If a child has both conditions and we only address one, the outcomes will not be optimal. I see many cases where a child has been treated for ADHD for 2 to 3 years with some improvement, but the underlying autism was never identified. And the therapy was therefore incomplete. So please remember, it is not an either-or situation. Both can be present, and each needs to be addressed individually. So what should parents look for? Let me give you the key red flags for autism first. Reduced or absent eye contact by 12 months. No pointing to share interest by 12 months. No babbling or single words by 12 to 16 months. No two-word phrases by 24 months. Loss of previously acquired language at any age. This is a very important sign. Repetitive movements such as hand flapping, rocking, or spinning, very strong insistence on routines, unusual responses to sensory input, either very sensitive or seemingly unresponsive, limited pretend play. If you are seeing several of these together, please do not wait. Early assessment is always better. Now, the key red flags for ADHD: persistent difficulty staying seated or waiting for a turn, acting before thinking, blurting out answers, interrupting, running into situations, very easily distracted by small sounds or movements, difficulty completing tasks even when they start them with intention, frequently losing belongings, excessive talking or movement that is out of proportion to the situation, poor short term memory for instructions. Now, here the important thing we should remember is these symptoms must be present across more than one setting, at home and at school, and they must be causing a real functional impact on the child's daily life. Every child is active and inattentive sometimes. That does not mean ADHD. Parents, if you are seeing any of these signs, here is what I would recommend. Step 1: do not self diagnose from YouTube, including this video. Step 2: consult a qualified developmental pediatrician who can do a proper assessment. Step 3: ask specifically for a differential diagnosis. This means you want to know, is it ADHD, autism, or both? And what is the recommended intervention plan for your child? Step 4: start early intervention as soon as possible. Whether it is speech therapy, occupational therapy, behavior therapy, or a combination. And step 5: remember that these things have to be individualized from child to child. No two children on the spectrum are the same. I hope this has given you some clarity today. If you have a specific question about your child, drop it in the comments below. I read all of them. If this video was helpful, please share it. Check my detailed videos on autism and ADHD. अपना भी ख्याल रखिएगा. See you in the next video.